Good afternoon. Today we're going to focus a bit on some guidance around safely gathering for the holidays, but first I want to give an update on the COVID-19 data. Yesterday, the Department of Public Health reported 3,572 new cases. 56,000 cases plus 56,000 tests were reported, and we've now done over 9.6 million tests so far in Massachusetts. 1,788 people were in the hospital, and 354 of those were in the ICU. Now, in the weeks leading up to Thanksgiving, the Department of Public Health put out guidance emphasizing the safest way to celebrate the holiday would be with members of your own immediate household. Unfortunately, a few days after Thanksgiving, we started seeing significant increases in new COVID cases and hospitalizations. This increase accelerated some troubling data trends and has put a significant strain on our healthcare community. In the 10 days before Thanksgiving, Massachusetts was averaging roughly 2,500 new positive cases a day, and that was included with a higher testing volume than we had seen previously. But after Thanksgiving, our numbers shot up, and the 7-day average on December 1st was about 2,444 cases, which would have been 4 or 5 days after Thanksgiving. And 8 days later, which would have been 13 days after Thanksgiving, that number had nearly doubled to almost 4,800 cases a day. That's a 96% increase in a little over a week. Similarly, prior to Thanksgiving, our positive test rate was pretty stable and had consistently been somewhere in the 2-3% range, under 4%. The current test rate, as most people know, is around 5.7%. Those combination of facts have translated into a significant increase in COVID-19 hospitalizations over the past 3 weeks, up by 93%. Patients in the ICU have increased by 73%, and patients intubated have increased by 104%. We've also seen deaths increase by 84% since Thanksgiving. 689 people have died in Massachusetts since Thanksgiving due to COVID. I don't need to tell anybody that these aren't just numbers. They're people and their stories and their relationships. Families have lost loved ones. People's lives have been shattered, and our hearts continue to go out to them. But the data points do speak to how COVID-19 moves. It doesn't stop. Many people have light or no symptoms at all, but at the same time, it can make others horribly ill. Roughly half the people in Massachusetts who get COVID never feel sick, never show any symptoms, but they can spread the virus again and again. Public health officials in our administration have warned folks for weeks to avoid large holiday gatherings heading into Thanksgiving, because when folks are at home with family or friends, they do tend to let their guard down. That's where the virus thrives, and over Thanksgiving in Massachusetts, it clearly did. More people are sick, our hospital system's feeling the strain, more people need hospital-level care, and healthcare workers are being pushed, once again, to their limits to take care of those with COVID and others. It's not a secret that we're in a second surge here in Massachusetts. And while hope is clearly right around the corner, arriving in dry ice in the form of a vaccine, it's not here yet. Getting through this period between now and when that vaccine is more available to people around the Commonwealth requires that we all do things that we know can stop the spread. Wearing masks, avoiding groups, staying within your immediate household, engaging in good hygiene. After seeing what happened in the aftermath of that one day, Thanksgiving, I don't think we should kid ourselves about the holidays in December. I'm pretty sure I'm stating the obvious here, but the holidays won't be the same as they've been before. Christmas, Hanukkah, Kwanzaa, New Year's Eve, they simply can't, and for most people won't be the same. But I'm here today to say that we really can't have them be the kind of consequential event that Thanksgiving has been here in Massachusetts. We really do need the help of everybody to make sure that we don't have a repeat, so that our hospital system can continue to provide the critical medical care that it does so well for those who need it. And I can't emphasize enough that this is not forever. This is once, one time, 1 month, 1 year, where Christmas, Hanukkah, Kwanzaa, New Year's Eve really do and should be different. Next year, we'll probably be able to celebrate those holidays just like we used to, but not this year. Now, later today, DPH will release guidance on safe celebrations for the holidays. Secretary Sutters will talk more about that in her remarks. But it's pretty simple. The safest way to celebrate this year is with members of your own household, and to postpone or cancel any travel plans, and to avoid gatherings with people you don't live with. Any type of celebration beyond that has real potential, as we saw with Thanksgiving, to spread the virus and hurt the ones we all love most. Now, Suffolk University put a poll out the other day, and one of the questions they asked in the poll was, how do you plan to spend the holidays? Now, roughly 70% of the people said they plan to spend them either with their immediate household or alone, and about 30% of those surveyed said they plan to spend it with people outside their household. To those who plan to spend the holiday with people outside their household, I would really ask you and urge you to first of all reconsider that, recognizing how difficult in a time like this that is for everyone. But if you must, you should treat it like a formal, traditional event that takes place indoors with people you don't live with in the midst of a pandemic. Which means people should wear masks, they should open the windows, they should use good hygiene, they should distance if they can, and follow the rules that have been put in place and proven to be successful in so many other ways since the beginning of this pandemic. And I say that for those you love and for yourselves, with the recognition and an understanding that we just saw this movie, and it dramatically impacts those closest to you and the rest of us here in Massachusetts. Now, our hospitals have pivoted to their surge plans, and they've created capacity, and they've postponed elective surgeries in order to meet the demands of our residents. But we need to help protect them too, so that our residents can access the medical care that they need. Our goal all along has been to protect public health while keeping schools and the economy as open as possible. But if our hospitals can't keep up, we have few options left other than more restrictions. And we know that the people in Massachusetts have been through a lot. Anybody who's seen the lieutenant governors or my email box knows that. Isolation, uncertainty, real sacrifice. It has been a very tough year. But there's hope on the horizon here. Yesterday, Massachusetts hospitals started receiving their first shipments of the COVID vaccine. And so far, 4 hospitals have received about 6,000 first doses. Today, the Commonwealth is expecting the federal government to ship about 53,625 more doses to 17 more hospitals statewide. This is part of the first 300,000 first doses of the vaccine that are expected to rise before the end of December. And yesterday, the first resident of Massachusetts received a COVID-19 vaccine. Martha Klessens, a 96-year-old World War II veteran, received the first vaccination at the VA Bedford healthcare system, and she is also the first VA patient nationwide to receive the vaccine. Today, the first healthcare workers here in Massachusetts will be vaccinated. And phase 1 of the vaccine plan is very much underway. Clinical and non-clinical healthcare workers providing direct and COVID-facing care are getting vaccinated first so we can protect our healthcare system. Vaccines are being delivered directly from the federal government to the hospitals, and in line with the state's vaccine prioritization framework, hospitals have developed plans to vaccinate their eligible staff members. We expect the rollout of vaccinations to this group to last several weeks for most hospitals. Vaccinations will start for long-term care families, rest homes, and assisted living facilities for both residents and staff. CVS and Walgreens will assist with vaccinations, and we anticipate this phase will begin around the 28th of December. And pending the approval of Moderna's emergency utilization authorization, we expect another 120,000 doses of the vaccine to be sent to Massachusetts in the next few weeks. These doses will be distributed to hospitals, community health centers, and other large ambulatory care practices. In all, we expect to receive about 300,000 doses, as I said, by the end of the year. Hospitals will report their vaccine data into the DPH, which will record the number of vaccines administered to residents. In coordination with the COVID Command Center, a public dashboard that keeps track will be launched next week. Secretary Sudders will share more on this in a minute. And with vaccines starting to arrive here in our state, the path back to something that looks a little more like normal is just around the corner. But it's critically important for us all to stay the course in the meantime. And that means continuing to wear masks, not spending time with groups of people in informal settings who aren't part of your immediate household, going to work, following the rules, going to school, and sticking with the people you live with, just to get us through this difficult winter. The fact that we are, in some respects, on the last lap should make doing some of these difficult things that we've been doing for months a little easier to put up with. A few more months of masks and distance and COVID precautions and not letting our guard down is right there in front of us and the right thing to do. And if people stay home and celebrate small this year, it will help everybody work their way through the beginning of next year. We have a chance here to play offense, but it's critically important for all of us to do the things we need to do to get from here to there. With that, I'll turn it over to Secretary Sudders.
Good afternoon, Governor, Lieutenant Governor, Melissa Jocelyn. Thank you for joining us. Everyone, as the Governor indicated, our plan for the first round of vaccine shipments maximizes life-saving care for our most vulnerable residents and protects our healthcare workers, performing COVID-facing work duties so that our healthcare system can continue to respond to our healthcare needs. In the coming weeks, our vaccine plan will continue to be refined based on the anticipated federal authorizations and the cadence of shipments from manufacturers. Based on the federal guidance to date, we've been told to anticipate, as you've heard from the Governor, 300,000 initial first doses, 180,000 of Pfizer, and 120,000 of Moderna, pending authorization, of course. Some of the first wave will also be allocated to the Federal Partnership for Long-Term Care Facilities that will begin on or around December 28th. There have been questions on the shipping process for the vaccine in the last few days. To clarify, the Department of Public Health places vaccine orders with the federal government on behalf of our providers. From there, the vaccine is shipped to the hospital facility directly from the manufacturer. In other words, the state does the planning, places the order, and the federal government activates the manufacturing shipping authorization for the provider. There's also been, as you heard, questions about how hospitals are approaching vaccinations for the staff. Hospitals and other healthcare facilities know their employees and their systems and situations best and are responsible for determining which healthcare personnel in what cadence in their facilities are vaccinated. In the coming months, there will be enough COVID-19 vaccine to vaccinate all healthcare personnel. Every facility had to attest that they will administer the program consistent with the plan that was accepted by the Governor and by the federal government. At this time, it is COVID-facing direct care employees, including direct support work such as dietary environmental staff, as example. It was recommended and has been recommended that the vaccination process occur staggered over a number of days in the event of any potential side effects and to ensure that you get the maximum number of staff. Over the next 2 weeks, 110,000 of the 120,000 doses of the Moderna vaccine are expected to be shipped pending FDA approval of their emergency use authorization. The doses, as the Governor said, go to hospitals, community health centers, and other large ambulatory care providers and practices. 10,000 are being held to count for provider enrollments, new enrollments coming in, or other necessary provider adjustments. Additionally, CVS and Walgreens, which we're grateful for, begin vaccinating staff and residents in nursing homes the week on or about December 28th under the CDC's Long-Term Care Pharmacy Partnership Program. Their doses, as I said, come from the state's Pfizer allocation, so between 40 to 60,000 will be shipped to CVS and Walgreens for our Massachusetts skilled nursing facilities. That's 379 facilities. This vaccine process, much like COVID-19 in general, is fast-moving, ever-changing, and we will continue to calibrate our plans. We will provide updates on a regular basis. Yesterday, I hosted a provider call with the Department of Public Health where more than 2,700 individuals participated regarding the vaccine rollout. The feedback helps because it helps us target our questions into very specific FAQs. For regular updates, please visit mass.gov/COVID vaccine to learn more about the distribution timeline and when you can expect to have access to the vaccine. Individuals with questions about what phase they can be vaccinated, where does their particular position fit, can send an email to COVID-19-vaccine-plan-ma@mass.gov for prioritization clarifications. Obviously, there's a lot of questions because when we put the plan out, it's sort of in large tranches. So we've provided a specific email address for folks to say, where does this type of position fit? And twice a week, we will update the website to clarify where positions fit for prioritization. Shifting gears, this Thursday, 4.5 million Massachusetts residents will receive a message via the Everbridge Resident Connection Alert System. Public Health Commissioner Monica Burrell will remind all of us of the increased risk of contracting and spreading COVID-19 over the holiday season. The message will be sent in Spanish and English. Residents can choose to receive future messages by text, email, or phone in their preferred language by opting in at mass.gov COVID alerts. As Governor Baker indicated, our case and hospitalization numbers continue to increase, a troubling trend. Hospitals are balancing the needs of all of their patients, postponing elective surgeries in order to ensure capacity to meet their patients' full health care needs, COVID and non-COVID related acute illnesses. So, to all of us, as we plan for the holidays, it is important, essential, to understand that we're still very much in this second surge. And because of this, holidays need to look different. There are measures you can take to protect yourself and your loved ones from COVID this holiday season. Postpone or cancel travel this holiday. If you do travel, please ensure you comply with the mass travel order requirements. Limit in-person gatherings to, as you heard the governor say, to only the people you live with, your tightest bubble. Keep it small. Host a virtual holiday dinner with extended family and friends. It is important to remember, any time you gather with others, you increase the risk of contracting or spreading COVID. You are not only risking your own health and others if you host or participate in any in-person festivities. If you or anyone in your household has been diagnosed with COVID-19 and has not completed the isolation period, has symptoms similar to COVID, is waiting for a COVID-19 test result, may have been exposed to someone with COVID-19 in the last 10 days, or is at increased risk of severe illness from COVID-19, such as older adults or those with certain medical conditions. So instead of the traditional holiday dinner party, prepare foods for family and neighbors and deliver them. Virtually attend your traditional holiday activities, such as a visit with Santa or whatever that may be. Consider virtual caroling or reciting. Provide a link to your virtual caroling to the people you want to sing to. View holiday lights from your car. And when shopping for the holidays, consider lower risk options, such as shopping online, shop local, of course, or if you choose to shop in person, wear your face covering and keep your distance from others. And please remember to keep the basic preventive measures, which you've heard so often from us, to wear a face covering and mask, wash your hands, keep your distance, avoid groups. As the governor said, this is a one-time event. It is this holiday season, and if we all do this well, we will have much joy and celebration next year. Please follow the DPH guidance to help stop the spread of COVID-19 in our communities. For more information on holiday guidance, visit mass.gov/holidays. Before you venture off on your holiday plans, please remember, actions have consequences. Thank you. And now it's my privilege to introduce Melissa Jocelyn, who is a nursing director at the Mass General Hospital.
Good afternoon. Thank you, Governor Baker, Lieutenant Governor Polito, and Secretary Setters, for your consistent leadership and guiding our state through these challenging times. On behalf of our medical colleagues, thank you for your support. We appreciate it. I would like to acknowledge and thank all of the medical personnel from across the country and those at Mass General, on Ellison 12, and all of the patient care areas who have been working relentlessly caring for patients from all walks of life. We realize everyone is tired and exhausted. In the hospital setting, we are also tired and exhausted. We are tired of seeing people dying on breathing machines. More sadly, even dying alone, where we use an iPad to connect a dying patient to their loved ones. We know you are tired, as it has been too long you haven't been able to see your loved ones, and the tendency is to simply give up and return to a sense of premature normalcy. There is light at the end of the tunnel, But remember, we are still in the tunnel. The sooner all of us adhere to the basics, not gathering in big crowds, keeping our bubbles small, continuing to wear masks, wash your hands, practice social distancing, the sooner we will be able to hug our loved ones, celebrate the holidays, and return to our traditions. This is a sacrifice for a short period of time. On behalf of all of our nurses and healthcare colleagues, I do want to join with the governor in asking, even begging, each of you to follow the state guidelines, to refrain from gathering for the Christmas holidays. We know this is a lot to ask, but this is a price to pay so you can celebrate freely with your loved ones after the pandemic is over while keeping them safe. We are committed to continuing our fight against COVID-19 and caring for each patient who comes to our hospitals. We just ask you to do your part so you don't end up in the hospital, or worse, be the reason why your loved ones, your grandmother, your niece, your uncle end up in the hospital due to COVID-19. Thank you.
See if these guys have any questions.
I have a question. Can you describe what things are like in the hospital right now, in a hospital setting for people as they consider going home for the holidays?
Sure. So the question is, can you describe what the experience is like now in the hospital as people are contemplating traveling for the holidays? Right now in the hospital, we are seeing an uptick in COVID patients. We are also seeing a lot more patients who are coming in who may have delayed their care from this prior surge because they have been waiting. And these patients are very, very, very sick. I will also share that the staff, the nurses, the patient care associates, the doctors, nurse practitioners are tired and exhausted to seeing continuous loss every day. I will also share that there are times when patients who are non-COVID come in with a primary chronic illness, and then later on we find out they are COVID positive. And that in itself also presents a lot of stress on the system and the staff. We are also experiencing many capacity challenges. And when I say capacity challenges, I'm really also referring to bed availability. So if you are a patient coming to the hospital, it may mean that you have to wait in the emergency room for a very long time, waiting for a bed to become available. And what we mean by that as well, as far as the impact, also realizing is that if you are now being among large crowds, also increasing your risk to contracting COVID-19, also increasing the spread, which also increases our hospital volumes. And that makes it very challenging to provide care for all of our patients.
How concerned are you about hospitals potentially being overwhelmed? Should we see the same type of thing we saw after Thanksgiving?
I am gravely concerned. I'm very concerned about that.
Do you think more restrictions are then needed? Do we need to go back to kind of what we did in the spring to prevent you guys from being overwhelmed?
Well, we really don't want to see what happened in the spring, and that's why we're really trying to enforce and also reiterate a lot of the interventions that we're asking the communities to do. So wear your mask, practice social distancing, don't travel, remain in your immediate household. If you do all of those things, that certainly can help reduce the stress on the healthcare system.
Jocelyn, can you explain, do you think it's getting worse than it was back in the spring? And try to explain to the public in general, like what you're seeing firsthand. A lot of people are saying, they're passing it off as something that they're just carrying, they may not get somebody sick, but just try to explain to people why it's so critical for people to pay attention to the protocol.
Well, it's really critical for people to understand the threat to our system, and that is COVID-19. COVID-19 does not discriminate, and many residents, many people may not realize that they are a carrier of the disease itself because they may not experience different symptoms. And that's why it's important to implement all of the preventative measures. And that is so critical for all of us to remain safe and to be healthy and to be able to provide the care that all of our patients deserve.
Melissa, could I ask you
What are you seeing that other people aren't? What are you seeing firsthand that they're not, and that's why they're like, well, it's not impacting us like it is.
I think one of the unfortunate pieces is that a lot of the symptoms aren't visual, and so unless someone reports it to another person or disclose that information, and I think that provides a false sense of comfort. I think the other component to that is if there is a false sense of, if there's a false sense of comfort related to that, then there's this belief that this really isn't real. I will say, anyone is welcome to come into the hospitals, and we see patients lying in beds, on breathing machines, patients on different types of oxygen devices, our staff going in to care for them at fear for their own lives. They have their own families at home. They have babies that they need to care for. When they leave work, there's still a concern that I don't want to bring this home to my family. I don't want to put my family at risk. Even during the Thanksgiving holidays, it would have been great for staff, nurses, patient care associates, physician colleagues to go home and certainly spend time with their loved ones. However, that was at a sacrifice because we understood if we did that, that would put the community at risk.
Melissa, do you feel safe taking the vaccine? And I ask you because the data shows us people of color are more adversely impacted by COVID-19, and yet they're also more likely to not trust the vaccine. So what message would you give them from a personal level?
Personally, I do feel safe taking the vaccine. When I look at Dr. Fauci, our scientist community, I look at our expert colleagues at Massachusetts General Hospital, I am very confident in taking the vaccine. And when the vaccine becomes available, I'm going to roll up my sleeve at the first opportunity and take that vaccine. This brings hope to us. This is the hope that we've been looking for. It also is certainly a major step in the right direction and moving us back to the life prior to the pandemic.
And would you urge people to trust it? Do you have family members or people around you that don't?
I do. I have an aunt, who was very concerned. She's 70 years old. And it was a matter of me having the conversations with her. When we think about Tuskegee and we think about the Henrietta Lacks cell and all of those kinds of things, it's a matter of looking at the timing during that time when those things were happening versus now. There's a lot more transparency. There's a lot more honesty. Kizzy Corbelt, I believe her name is, was a senior researcher and certainly helping to create the vaccine. She's African American, and she was also on Dr. Fauci's team. And so I think that also helps to reinforce a lot of the honesty and the transparency around the development of the vaccine.
Melissa, have you run into any patients who have COVID who didn't think it was that big of a deal, who have since changed their, what do they say?
Well, I think it's not until the symptoms become more severe where they feel like, oh, I didn't realize it could get this bad. I didn't realize that, I just thought it was a cough and my symptoms would remain mild. I think sometimes it's not until the reality sets in where they're in the hospital and now we're escalating the level of care because they've become so sick. And I think that brings home the reality.
Doctor, besides taking reports,
Hey, Matt, before you ask your question, I want to just say one thing to Charmin because it's on point. I got a text message the other day from a friend of mine who is no fan of most of what I've done over the course of the past 10 months. And he was texting me from the hospital during a moment when he wasn't on a machine because he's having trouble breathing. And he got it at an event where no one wore masks. And he said, now that I have it, I get how brutal this can be. And honestly, I'm scared to death not just for me, but for my family. One of the most insidious things about COVID is this incredible dispersion in what it does to individuals. I have a long list of people I know now who said, I got it, I lost my sense of smell, I didn't have any symptoms, it felt like I had allergies, it wasn't that bad. And I'm sure they've told that story hundreds and hundreds of times. But I also have a bunch of friends who got really sick. I have other friends who lost family members. And guess what? They don't tell that story very much because it's sad and brutal. Which is part of the reason why we asked Jocelyn to be here today. To speak to the very real fact, this thing's for real. And the fact that a bunch of people don't get that sick and carry it around and give it to others who might get really sick is a daily occurrence, not just here in Massachusetts, but all over the place.
Governor, besides taking reports from the hospitals about how they're distributing the vaccine, what do you view as the state's oversight role or responsibility in making sure that the vaccine rollout goes smoothly without taking other steps even beyond just taking data?
Well, I might let Mary Lou speak to that, but I think generally what we're trying to make sure of is that the vaccines get to where they're supposed to go when they're supposed to get there, and that people have plans in place that have been signed off by us and the feds to actually implement against the terms and conditions of the plan that we develop. But do you want to speak to this?
So obviously, the plan that you've seen is sort of broad in the three phases, and it's about 5.8 million people. So it's a plan that's going to keep evolving. So the state's oversight role is to ensure that, as the governor said, we submit the allocations, ensure that the manufacturers deliver the vaccine to where we put the allocation, and that's one. That's sort of like that part of the supply chain seems reasonably in good shape. And then is to ensure, obviously, that this is a 2-dose regimen. So it's not just ensuring that, 1 dose is administered, but that the second doses are also administered. So in terms of oversight, one is, Matt will be ensuring that first doses, then the provider gets enough for the second doses, and that individuals get the 2 doses of the right regimen is obviously one thing we will be looking at. We'll also be looking at to ensure that these have a shelf life, and that we will be very actively monitoring with hospitals and other providers that what is allocated is administered. Because this is hope, and this is wanting to vaccinate 5.8 million people in the course of months here. So part of it is ensuring that the vaccines go to where we've asked them to go, that the hospitals and other facilities have the first and second doses in order to administer folks, that hospitals will do random audits to make sure that facilities are in compliance with the attestation, which means that they're comporting to the plan that the governor approved and that the federal government approved. We'll be putting out a public dashboard, which I'm sure in the beginning, you'll ask, well, why aren't you putting out this data? So we will continue to iterate on a public dashboard once a week to see where we're going in Massachusetts. The number of providers, obviously the long-term care is very important to us. That's a federal partnership. But we'll be putting out who's gotten the vaccines, the names of the facilities and the like. So we will, yep, hello.
Could you speak to the distribution in corrections? That's in phase 1. Do you have a date that's going to start? And walk us through how that will take place. Will DOC personnel be administering this? Are they being trained? Or you have somebody from Walgreens and CVS coming in? How's that going to work?
So first is obviously healthcare, right? And then it's first responders, and we have corrections 24/7. So the congregate care is where corrections comes in, and there's a number of streams in this. So we have corrections, we have like group homes, like Department of Mental Health, Department of Public Health, Department of Developmental Services, group homes, large congregate care and small congregate care, both state-operated and state-contracted, as well as correctional facilities, both DOC and houses of correction. So it's so each of these work streams has a different set of parameters. And so for the Department of Corrections, for example, they have a medical provider. So we are working with EOPS and the Department of Corrections on who would be the best medical entity, if you would, to administer the vaccinations. And since they have a medical provider, that is sort of our preferred. If there's already an established relationship, we'd rather use an established relationship rather than bringing a new one, because it goes to sort of Matt's question, which is this is large and big. And so you really want to work with where you have respected relationships, and that's, so the medical provider with the Department of Corrections is our sort of preferred provider at this point.
Secretary, I have a question
Yep.
about the holiday guidance. A lot of people still think you could be outside and have a toast with somebody you don't live with, per se. What's your recommendation on that? Like, if you're outside for under an hour?
So outside with a distance is obviously better than sitting close, on the couch. I really, my advice, and we've asked a lot of people, is to really rethink this holiday season so that we can all celebrate next year in the way that is really important to us and our traditions. And, to get into like, well, what ifs if you're outside, or, we could have a blizzard and the like, is to really just this holiday season, like take the long view. And whatever the sacrifices are, however hard they are, that we can celebrate and have joy next year is really, like my holiday is very different this year than it's ever been, all these holidays, like many other people. And so what we're really saying is this year, this time, just be smart, be different, keep it small. I really do believe to wear face coverings all times, including in your home. And, so the holiday photos will be a little bit odd this year, but next year we'll all look at them and say, we all have smiles we can see. I'm really asking people to go deep and really think about next year's celebrations with all those people that we love.
Secretary, a logistical question. I had a hospital CEO tell me the Pfizer vaccine requiring a super cold environment should be sent to the hospitals, and maybe Moderna coming a few weeks later work out naturally, send that to the nursing homes. Do you see it working out that way?
So in fact, the first distribution, so part of our allocation and requests really had to do where you had ultra cold storage. So the Pfizer vaccine has been prioritized for those facilities that have ultra cold storage available to them, with Moderna being for folks who have freezers. Part of our Pfizer allocation is actually going to CVS and Walgreens for the nursing home distribution, because both CVS and Walgreens has ultra cold storage capabilities, and that then frees up, if you would, Moderna for broader distribution to smaller hospitals, large ambulatory surgical centers and practices, community health centers and the like. So that is very much part of our planning, is around who has the capacity to accept, as the governor say, the dry ice packages in ultra cold storage. And we are lucky in Massachusetts that we have a number of hospitals that have ultra cold storage. But the Pfizer, the 40 to 60,000 initial to CVS and Walgreens is the Pfizer.
And of course, it's 2020, so we have a snowstorm right in the middle of trying to deliver a vaccine. Does that throw a monkey wrench into things?
That's the thing about planning. You just keep planning, and we have lots of contingencies all the time. And you never know. It's New England, It could, maybe it doesn't snow. So we obviously, so today, 17 facilities are receiving vaccines. And one hospital, the governor and I were on a call with the hospital CEOs earlier this morning, and they were expecting it to come, say, around 7 a.m. this morning, and I believe the vaccines showed up in their warehouse at around, 4:30, 5 o'clock this morning. So, shipments occur even during blizzards, my friend.
Secretary,
I'm sorry.
Can I get an update on the field hospitals? How is Worcester going?
Yep.
The staffing issues, when is Lowell going to open?
Sure.
That kind of thing.
So the DCU has had 75 patients and has discharged 40, and they're ramping up to have the capacity for 75 patients at any time. So right now, they can staff up to about 50 patients, and they're hoping to have sufficient staffing the beginning of next week for 75 patients. The build-out of Worcester, I haven't seen the photos today, but my staff have informed me that the build-out is going quite well. What did I say? Worcester? Sorry. I got excited about field hospital development. The field hospital in Lowell is undergoing build-out right now. It looks very good according to my staff, and we're hoping that that would be online at the end of December, which is like 2 weeks.
Will you have the staff for it? Will you have the staff?
So, they're just like Lowell, similar to UMass, they're recruiting staff, and we'll do it in the same probably way of phasing in beds as, you have staffing available.
Secretary, with the public care settings,
Massachusetts Health Form is on the website, it's well known, and visitors coming into Massachusetts must fill it out. So is there any enforcement of this where it says you have a $500 a day fine if you fail to comply with that form and you fail to quarantine for 14 days? Has there been any case of a $500 fine as a result of that?
I do not know the answer to that question, so we'll have to get back to you on that. I do know that people get their texts every day about reminding them they're quarantined, but on that specific question, I don't have the answer.
Secretary, are vaccines also supposed to be administered to people who are in solitary confinement or otherwise segregated from a general prison or jail population, or is that something that could affect the timeline when those vaccines become available for that setting?
So it's for staff and inmates, all staff, all inmates.
Governor?
Thanks, everybody.
Yesterday, several cities, including Boston, announced they're rolling back to, I think it's step 2 of phase 2.
Modified, yeah, modified.
Does it create problems to have that patchwork of restrictions, and does it force your hand in terms of considering a rollback of the entire state?
Well, we've had, from the beginning of this, our basic approach to dealing with this statewide and locally is to basically take the position that whatever direction we're going in, we're basically going to set a statewide platform, and then locals, if they think they need to move in a different direction, can. And if you think about the reopening, which the Lieutenant Governor unfortunately knows every single detail and every single date, starting on May 18th, when we reopened on a set statewide schedule, and there were communities that followed the same schedule that we did, and there were communities that didn't. There were some that you couldn't go faster than we went, but you could go slower, and there were a bunch of communities that went slower than we did on reopening on particular things. The same thing's been true with respect to some of the steps we've taken to tighten over the course of the past, now it's over a month, the past 6-7 weeks. And there are some communities that have tightened more than we have, which they are permitted to do. The most recent example before this was probably Mayor Tyre in Pittsfield, who shut down indoor dining for a few weeks. I want to give locals the ability, if they believe they need to be in a different place, to make that decision, because not everybody in Massachusetts is in the same place all the time. And I think one of the things Mayor Walsh talked about that was important to him was to start bringing some of his special needs kids back, and he felt taking this move was an important part with respect to that. And I respect that, just like I did when he chose not to reopen construction back in the spring when we did reopen it on a statewide basis, and across the Commonwealth, most other folks went ahead. And both the Lieutenant Governor and I have been to events that were important to local communities that involved the completion of projects that they said wouldn't have been completed if we just shut construction down back in the spring, which we didn't. So I'm okay with people making decisions based on what they think makes the most sense for them.
What is your response to a local epidemiologist from Northeastern is saying if the state doesn't tighten restrictions now, we will be, quote, in a nearly untenable situation come January? What is your response to that?
So when we started the reopening process, people said it wasn't going to work and that it would fail. You asked me the question, Jonathan, what are people going to say about our reopening program? And I said people are going to say it's too fast and it's going to spike, or they would say it's not enough and you need to open things up. I fully expect that every decision I've made, that we've made over the course of the past 10 months will get challenged from both sides. And that's exactly what's happened. And what we've chosen to do throughout that is to talk to our colleagues in the healthcare community, our colleagues in the healthcare community generally, colleagues in the public health community, and to do everything we could to balance all the various issues that are involved and to make what we think are the most appropriate and best decisions for the Commonwealth. Now, we are basically at roughly, what is that, 1,700 on the hospitalization piece? We're around 1,700 on hospitalizations. We were over 4,000 in the spring. And we're at about 350 on the ICU. We were north of 1,000 in the spring. And if you talk to almost anybody in the healthcare world, they'll tell you, maybe I should have you back up to speak to this because we talked about it earlier. They know more about this virus than they knew in the spring. They believe, and I agree, that they are better at treating people who are dealing with it now than they were in the spring, both from a sort of process management point of view, but also in terms of some of the therapeutics and the tools they have available to them. And we're going to continue to make what we think, balancing all the various issues and concerns people have, are the best interests of Massachusetts. I will say that for weeks now, months, I and others on both sides of the aisle have been working our colleagues in Washington to see if we can get them to finally come to terms on a support package for the country with respect to many of the issues that remain with regard to testing, tracing, vaccines, housing, food security, economic recovery, support for small business, educational issues, and I continue to believe, based on the conversations I've had lately, that something may happen on this by the end of the week. And that would be a giant Christmas present, Hanukkah present, Kwanzaa present, New Year's gift to the people of this country on so many of the issues to create this balancing act that we're all struggling with.
Governor, the Attorney General put out a report saying that Bristol County House of Corrections did violate civil rights in that incident with the immigrants in the holding. In the Attorney General's report, though, she recommends that DPH and EOPS look at reviews of Bristol County and to see some systemic issues there. Would you cooperate with that kind of review?
How long ago was this thing issued?
About 20 minutes.
Is it okay if I read it before I respond?
Do you completely? Are you aware of this?
No, I'm not. I'm not. So,
Generally speaking, is that something that DPH and EOPS would be willing to?
I'm not going to, look, Mike, I think you know that when we have a chance to look at it, we'll get back to you with a response. But I'm not going to respond to something I haven't heard of, I don't know about, and I haven't read, okay? And I don't think I'm being unreasonable on that.
Governor, the House said it's going to reject your amendment on the abortion access budget measure. I wanted to get your thoughts on why you have such concerns about lowering the age to about 100%, but also if you were to get that same manufacturing, would you veto it?
So, first of all, we did express concerns about putting a major policy like that into the budget in the first place. which was a concern that was shared by both Democrats and Republicans. I happen to be enormously proud of the work that we've done with our colleagues in the legislature on a bipartisan basis over the course of the last few years to both expand women's access to reproductive health services and to eliminate some of the worst of the Massachusetts laws that were on the books with respect to this issue that date back practically centuries. And the response that we made to the amendment in the budget was designed to respond to a number of the issues that we felt needed to be addressed by a continued decision to expand access. And the proposal we made, if enacted, would give Massachusetts some of the broadest and most significant reproductive health rights in the United States. In many cases, we actually sided with sort of the tone and tenor of the House language during the course of that debate. I haven't heard anything with respect to what you brought up, Matt, but obviously we'll see how this all plays out. Thanks, everybody.